Okay, good afternoon, everyone. Welcome to the NNPCF's webinar on SEND Health Services with our colleagues from Health. You're very welcome, and this is a much needed conversation that we enjoy having at NNPCF and in our PCFs regionally. So we're going to do a little bit of an introduction and some background, which is why we've decided to do this webinar today. So we know from our conversations regionally that forums have been talking about SEND in their regional areas. Sarah, that might be me because I've come right out of another meeting, so I do apologise if I have some background. Please be assured that I'll be stopping talking soon and other people will continue. So there is a national response for SEND with community services, and Lorraine and Dave and Mike, will be discussing that later. We are talking regionally, and we know we're having lots of conversations with you about what the regional SEND offer looks like, but we wanted to link in the national response with that regional response so that it was clearer for our PCFs. I will hand over to Lorraine and Mike now, I think. That's helpful.
Thank you, Kath. Good afternoon, everyone. I'm Lorraine Mulroney, the National Specialist Advisor for SEND and NHS England Improvement. I have some of my regional colleagues joining me today, and Mike Davis, our national colleague, who's going to talk through stuff around community services. It's great to have this hour to give you an update on where we are with the national team, where we are regionally, so that we can reconnect. Because I think it's important. We have lots of new people now. So I'm managing the slides, but I would just going back to Kath or Marunal, because the next two slides are from NNPCF, where you are sharing some of your views with us and reconnecting how things are and some of your 10 priorities. So it's back to you, Kath or Marunal.
Absolutely, Marunal and I will cover this. So I think the message was really clear that we are not back to normal. We've had a very strong message from you all that things are not easy after COVID. The pandemic has made the pressures on community health services, therapists, CAMs, paediatricians, really lengthy. And this is causing problems for families, it's putting stress on systems, and it's increasing harm with our families, and we're all seeing that. The loss or reduction of services during the pandemic has seen some of the existing users deteriorating and needing more specialised services. We hear this from our families and our membership widely. It's further impacted by target and specialist services being on hold, and that's causing problems on the system. So it feels like there's real blocks at the moment. We're hearing families being really frustrated at the end of the tether, and that's really hard for us as forums to support families when we don't always understand how that links back. So as a result of those extra pressures in the system, there is a struggle for services to manage EHCPs, annual reviews, the whole workload around that and advice. And in turn, there will be greater demand for EHCPs and more looking to tribunal to obtain the support they need. We know that in the pandemic, when we said EHCPs received a certain amount of support throughout COVID, that led to lots of families losing faith in the SEND support prior to that as well, which has put additional pressure on. So you're telling us all this, and we know this, we're seeing this also, and so are the professionals we're working with. But we need greater conversations, like Lorraine said, around reconnecting, just being really clear on what the national team is saying and also what the regional offer is, as well as the localities. So we did a survey, and I'm not sure if Marunal's here and he wants to come on and he's got sound, because I'm very mindful my background may be a little noisy.
Why don't I take this one, Kath? That's fine. So hi, yeah. So prior to our conference in March, we did a survey of local parent care forums. We asked you guys to choose your top 10 priorities from a list of about 40 that we gave you. These are the 40 things that we were hearing nationally quite a lot about. And this is the list that you gave us back, the top 10 local issues. Now, 3 of those are directly related to health services and the issues that health services are facing in the wake of COVID. So waiting times for assessments, access to mental health services, waiting times for community therapy services. These are really strong messages that we're getting from our member forums. There's also within this list of top 10, the other another 4 of them are things that we know are linked to health services. So SEND supported schools, the quality of the HCPs, emotionally based non-school attendance and annual reviews. We know that the input from health services, local health services, has been hurt by the wake of the pandemic, and we are very much playing catch up. So this is the context in which we put this webinar together. And when we shared these findings with Lorraine, we asked her to really come back and speak to you directly about what the NHS and the Department for Health and Social Care is doing with all this information that we're giving them. And by the way, their own data is telling them the same things as well. So really, at this point, I'll hand over to Lorraine and Mike and ask them to really tell us a little bit about the work that they're doing nationally and regionally to address these things.
Thanks, Maruno. Unfortunately, I'm having trouble with the slides, so I'm not able to do slideshow from the comments in the chat. So you will get, copies of the slides, and hopefully, listening to the conversation will also help. I'm going to move on before I bring in Mike, just to talk a little bit about where we are with the SEND team nationally and how we're operating, because it's a new team that I'm creating. We're 2/3 of the way there in terms of recruitment. So we received some additional funding from NHS England Improvement to resource a national SEND team. Those of you who have met me before know that it's been Team SEND has just been Lorraine for a while, so it's fantastic to have a team working nationally. And we've also had funding to increase the regional SEND structure. So the next slide will show you who works in region, what their names are, and what it looks like across our 7 regions. So you'll see when you get the slides, it's a fairly small team, but 6.2, I think, whole-time equivalent. So 6.2 people working full-time, and if we add up all of our hours that we do, is great. And it's a mixture of different staff. So we have clinicians and policy leads, and we also have a young person advisor post that hasn't been out to advert yet, and our family care advisor post. We have interviews in the next 2 days, so I'm really excited about those 2 roles. Introducing our team. So we have Andrea Ferns, who's our nursing professional manager. Andrea's focusing on the work around supporting children, young people in nursery schools and colleges around health needs. We have Anne Gordon, who's our allied health professional lead, and Anne is an OT by background. Anne works across the children, young people's team, the SEND team, and the allied health professionals team in NHS England. And Sarah Childs, who's our designated therapies professional manager. Sarah is a speech and language therapist by background and is also a designated clinical officer, and the same with Andrea. They have split roles, they work locally as well. And Zara is our business support officer, and we're recruiting to policy officer to support Rebecca Dewar, who's our policy manager. And Rebecca works across the SEND team and the children, young people and learning disability and autism team. So all exciting, but great to have new people. And we work obviously really closely with the DFE and the Department for Health and Social Care and our national colleagues, which I'll show you in a minute, the different teams we work with. This is our regional structure, and I'm not expecting you to be able to see all this, but when you get the slides, there are 7 regions. It looks different in different regions in terms of numbers of people, because that's how they've worked in terms of what it is they need in their region around SEND. There are 2 posts that are still vacant that are going through recruitment, but if you look across everyone, we have a total of 27 people working, and that is a much improved position than we've had for many years, and it's very exciting, because having a regional structure, which is our delivery, our operational delivery, is how then we will support local systems. So really important to strengthen our regional approach, and many of our colleagues are here today, and we are going to hear later from our London regional colleagues about how they are working. If you don't know who your regional colleagues are, that's also really important, because then hopefully by the end of this, you will start to make those connections. I mentioned around SEND working across different programmes and different projects across the children's space nationally. There are 14 different programmes and projects that have interdependencies with our work and SEND. I'm not going to go through them all, but they're fairly straightforward. But I think when we talk about SEND and we talk about children and young people, they go together. It's not one or the other. So we have to connect with all the other children and young people's projects and pieces of work. And then I want to just tell you a little bit about our programme of work and what that looks like at the moment. So you'll obviously be aware that the SEND review is still out for consultation. But we're working cross government and supporting colleagues on that. We have some health events for health colleagues in the next couple of weeks, where we're going to focus on what the SEND review means for health. And that the colleagues that will come to those events are our executive leaders, our senior responsible officers, our designated clinical and medical officers, and commissioners. We will continue to work delivering our inspections with CQC and Ofsted, supporting that piece of work, working jointly with Department for Education, and our regions are the force in terms of the delivery to support the inspection work. That's their business as usual. Transferring statutory duties to the integrated care boards, that's been a particular focus for us over the last 8 or 9 months, and obviously as the integrated care boards become a legal identity on the 1st of July, it will still be important for us over the next year, supporting these new leaders, new structures, and making sure that their statutory duties for SEND are transferred over and smooth, and we are clear on governance and leadership and accountability. That's a big piece of work. So our regions have been doing what we call heat map exercises. So seeing where systems are, what support they need, and their transition of their journeys. And we're just on stage 3 of that now, pulling together those resources, and we'll be working with our colleagues in the ICBs over the next year and a half anyway, as they transition into these bodies, because they have a transition year, even though their legal identity on the 1st of July. Then we will be setting the direction for the designated health officer function. So designated clinical and medical officers, as we call them now, through the SEND review, we are going to clarify their functions and roles, and that's something that Sarah Childs will be picking up and supporting us nationally with. And then we'll be working with Andrea's piece of work on clarifying the legal framework around clinical and care interventions in education settings. So, how we support children with health needs in any education setting, and make sure that health and school staff are working together and that children are safe and well. So that's a big piece of our work. The last piece of work is join up with community services, looking at the speech and language and OT, waiting times, deep dive we're doing for therapies in the North East and Yorkshire and Midlands, and that's really going to inform our way of working and our joint approach. But obviously the workforce side, you'll have noticed in the SEND review around community services and SEND health workforce, we need to join up with the Department for Health and Social Care and other colleagues on workforce. So that is our programme of work. and I'm going to come to Mike now to talk through the community services so you understand what's going on. And there are 2 slides on that before we come to London. So thanks, Mike. Thank you, Lorraine. So Mike Davis, I'm currently the Deputy Director for Children's Community Services and on loan from DFE, where I was working on the Centre Review previously. So some of you may recognise me from that. And it's always a pleasure to reconnect with colleagues in the NNPCF. A bit as Lorraine said, our Children's Community Services team is a small and perfectly formed. So it's been largely me for the last few months. We're currently recruiting as well, so the team will be kind of growing over the next couple of months and putting together a work program for the rest of this year. So there's less I could say about the detail of that, but I mean, I think this slide very much echoes either your one at the start of the presentation. We're well aware of the challenges and the pressures that services are under. I think historically we've really struggled to get good data on that. And one of the things that's come out of the pandemic is we've perhaps got more visibility than we've ever had around what's happening in the community. And we know there's currently around 2% of children nationally on a waiting list for some form of community support. And as you highlighted rightly, the longest waits and the largest lists are for community paediatric and speech and language support, where they're up to 20 and 13 weeks respectively as a median. So one of the things I think we have managed to do is to bring some more visibility to that. We did publish for the first time back at the start of the year some data around what's happening, and hopefully that's going to continue now as we move forward. If we move on to the next slide, just wanted to highlight perhaps just a couple of things in addition, obviously, to everything that Lorraine has talked about, and we do work very closely on across that agenda. We have, for the first time this year, got an entry in the NHS planning guidance on community services that focuses on waiting times. We've asked systems to make sure that they have a grip locally, they can quantify what's happening across both adult and children's services. And then that they have a plan for how they will try and bring that down and submit trajectories for improvements. So that process is in hand and being monitored. And then I think there's also a really big agenda here around the data, which is a big focus for us. It's certainly true that what gets measured is what matters in the NHS. We do really need to improve our understanding and insight here. So we've got 4 objectives that we're looking to make some real progress on this year, as outlined here. So reducing the sort of time to insight. So we're collecting much more real-time data and publishing that and making it available. That is as least burdensome as possible for the providers who have to submit it, so we get wider coverage. So the quality is improved, and there's a long way to go around standardization and consistency there. And then also what we're asking for is aligned and supporting what is needed and helpful locally. So it supports integrated models of delivery and new models of care. We're sort of incentivizing that rather than adding new burdens. I think as we get that picture improves, we'll be in a much better position, I think, to make the case nationally as we look ahead to the updates to the long-term plan and the next spending review when it comes, to make the case for more investment where we know it needs to go. That was all I wanted to add to what Lorraine has already said. Thanks, Mike. I don't know if it's appropriate at this point if we want to take any questions before we move on to London. Maruno, Kath, colleagues?
We've not had any questions. I've been monitoring the chat. We had no questions in the chat. at this point. But
Okay.
what I suggest to do is we keep going, and if people have any particular questions or examples or the types of challenges they're facing that they'd like Mike or Lorraine to comment on, then I think that would be really useful. Just pop them in the chat and we'll put them to Lorraine and Mike at the end.
Great. I'll move to the slides for London then. Thank you. So it's over to Sophia and Stephen.
Thanks, Lorraine, and thank you everyone for inviting us to speak today. So my name's Stephen Trowbridge, and I've joined the London region as the SEND manager in May. However, I've come from the national team, the Learning Disability and Autism program. Specifically, I was working in the Children and Young People's team for the last several years. And just reflecting on that, you know, joint working with parent carers, networks and forums have been a very positive experience. And I know it's changed the focus of my work. And I know that attending these meetings have been very helpful for me to understand what parents and carers are going through. And over the last 5 years, I've had the pleasure to work with some truly amazing parents and young people and I can see a few people here, and shout out to Mary Busk, who is an amazing person that I've had the lovely experience of working with for the last few years, and really changed the focus and the way I approach work through Ask, Listen, Do, and other programs that we've worked on together with parent care forums. Sorry. But today we're going to show our experiences with the Pan London team. So on the slide there, we have Roz and Fazila, who are key members. No worries. Are key members to the team for helping us deliver this. But I'll hand it over to Sophie.
Thank you. Thank you so much, Stephen. And good afternoon, everyone. Lovely to be here. I'm Sophie. I am the Children and Young People Clinical Lead for the London region, and I'm working with Stephen. And just like Stephen, I also started in January, and I was coming from Newham as the 0 to 19 children SEND lead there. And I'm so excited to be here because I think ever since we started, we've seen a lot of progress with how we've connected with our parent carer forums. And Ras and Fazila, as you can see, are much part of our team. And in all the things that we've been doing, I've learned a lot from them and how they impact on the support that they provide to their children. So looking at how we've worked, so we are just giving you just a case study of how we started in London and how we have been working with Ras and Fazila and the parent carer forums. So one of the networks that we attend is the Strategic Managers Parent Carer Network meetings, where we kind of hear feedback from the managers and also from the parents about the experiences that they're having locally. And then we've also been meeting with the parent carer forums like the Pan London Parent Carer Forums, where the leads from all the systems come to this meeting, all the local areas come to this meeting where they are discussing with us their concerns. And during that time, what we have seen that works really well is the level of communication, because what we do is we leave them to be able to kind of let us know what is going on and have like a free flow discussion where the parents are bringing their concerns to us. We've collaborated with them and listened to them and respected all their kind of ideas and the things that they're coming up with. So we've had feedback from our parents that it's been really refreshing to see the faces that are behind the regional teams and who are supporting the ICSs into their development. And therefore, that has made such a huge difference. So we've had to develop a plan of how we're going to continue to support them going forward. We know that from a regional perspective, it can be very, not difficult, but because we are so removed sometimes from frontline care and we are more providing strategic support, that we might not hear from parents a lot more, and that the impact on the ground can be completely different. But how we have worked with the Pan London parent carer networks has brought us closer to the delivery of the programs within SEND, and also has helped us to develop a plan with our parent carers. And the plan going forward is moving on. I think we'll move on to the next one, Lorraine. Thank you. Yep. We have acknowledged that we want to be able to apply strong principles of co-production and accountability at every level. So this is not just locally, but also from our regional functions to be able to work closely with parents and carers. And we've also done like joint strategic planning with our national parent carer forums. So we know this work was actually commenced by my predecessor, who was working with parents even in terms of developing like some of the strategic plans for the region, and we are going to continue with that. What we've also wanted to do was to make sure that there are themed events and meetings that are coming out through the feedback that we're receiving from parents, and things like, you know, the "you said, we did" kind of feedback, and this will be coming from the local system. So our ICBs and ICSEs being able to deliver those programs for parents so that they can hear what is happening on the ground. We acknowledge that there is differences in each and every area. So sometimes parents are coming maybe with issues that are happening because we've got 5 integrated systems in London. So what might happen in the Northwest might not be similar to what is happening in the Northeast. But what we want to do is to be able to kind of share that information, and so that we can have good practice examples that are replicated across. If we know of areas that are doing really well, we want to be able to learn from those areas and be able to co-develop services with our parents and our carers. We also have our ambition is to make sure that our parents are also involved in delivering the written statements of action. So we know co-production is a really key area of development in those, because we want our parents to be able to give us the feedback and be involved. So we're working very closely with our parents carer forums. We know these areas are our forward plan, and this is our ambition, and we're really looking forward to delivering this. There are obviously areas that we have acknowledged and that we'll be focusing on with Russ and Fazila's help. Areas like obviously what you have acknowledged: long waiting times, pre-diagnosis support, links with social care, and obviously not forgetting the overwhelming burdens of caring responsibilities, because we found some of our parent carer networks have been very overburdened with being able to connect with us and being able to be a part of that co-production team, because they have a lot of work that they still need to do. And we're hearing that over and over again, like from the discussions that we've had so far. So we're really, really looking forward to the plan and going forward into the engagement and how this is going to impact on the developments and also the service improvement going forward. Thank you. I don't know if there are any questions.
I think there are some, but it's not loading up for me currently. One moment, apologies.
Shall I front the questions?
Yeah,
so
thanks.
you've got a bit of background noise there as well. So I think that's a really interesting case study, Sophia, around. And thank you for sharing around how regions are coming together and working to address some of the issues that we highlighted earlier in the pack. One of the questions, I think, starting with the questions, I know you answered this in the chat, Mike, but we always try to call out the questions in the verbally as well, so that everybody can follow them. But the stat that you used earlier, saying that 2% of children and young people were waiting for services, for health services at the moment. Would you? The question was, is that all children and young people, or 2% of children and young people with SEND?
Yeah, so what we've done is, so the collection that we are gathering at the moment every month comes from about 140 providers, So that's our sort of numerator. That's where we're getting the figure for the number of children who are waiting for a service at the moment. That's not comprehensive because it's not a 100% coverage. And then to get the percentage, we've just looked at what the ONS population statistics are for 0 to 18-year-olds in each region. So it's a bit of a sort of back of a fag packet calculation, but it gives you a sense of where the variation is. So it's particularly the southeast and the northwest, which seem to have the largest proportions. And overall, nationally, it comes out about 2%.
I think that's really insightful, isn't it? Even if it is a very crude measure, we appreciate that. But it's 2% of all children are waiting for some sort of community-based health service, of which a large proportion will be SEND services. I suspect gives us a pretty strong indication of where we are, and very much tallies with the anecdotal feedback that we're getting from parent care forums as well. Okay, thanks for that, Mike. Just another, maybe a follow-on from that is we had a question around waiting times, just around those waiting times, in that there's a sense that we hear, I'm paraphrasing the question if I may, that we often hear of the 18-week target being triaged or managed, if I can put it that way, whereby initial contact is made within that 18-week period, but then actually people then have a much longer wait for a meaningful intervention and actual start of real meaningful therapy or meaningful help. Can you say anything about that? How NHS England or Department of Health and Social Care are actually looking at things like that and looking at and stopping that sort of almost manipulation of waiting times targets taking place? So
Lorraine might want to come in on the mental health targets specifically. She's perhaps slightly closer to that work than I am. Although, I mean, they have just published, they've consulted and published guidance now on how the waiting times targets as they apply to mental health service should work. But generally speaking, there isn't the raft of guidance that we have for like the 18-week standard. And so it is, and I appreciate it is a bit of a contentious area. I mean, for most of the community service that we're talking about, there isn't a waiting standard anyway. So 18 weeks doesn't really apply, and hence there's no real guidance on what and how you measure weights. That's something which we're trying to look at through the data collection route, just to make sure that when we're asking providers to submit data, they're doing it consistently. And absolutely want to distinguish between is somebody waiting for an initial contact or for then the subsequent service, delivery of that service. But ultimately, there's a debate to be had, I think, about whether there's a case for greater standardization here. Lorraine, do you want to add anything?
I don't think I can really speak for mental health because it's not my programme, but what I do know is learning from the pilots around the 4-week waits within mental health as part of the plan for the future. I've not personally seen any outputs of any of that, but it's something we can take away to our mental health colleagues who deal with that. As you say, Mike, 18 weeks applies to consultant-led services. It doesn't apply to nurses or therapists. There obviously is some nice guidance around waiting as well for different types of conditions, but it is something that we're aware of nationally and building into our plans. And I'm sure when we have the deep dive information from Midlands and North East Yorkshire around therapies, we will have a much clearer picture of where things are and how things are managed through contract and performance monitoring. It's on our radar.
And I think that maybe gives us a link into another one of the questions, which is around the SEND review and how are your respective teams inputting into the SEND review, and what input have you had into things, particularly like the national standards? So I think that's where we might want to see things like maximum waiting times, or targets or maximum waiting times for a lot of these community-based health services, which families are crying out for. Can you just say a little bit about your thoughts around, firstly, about how you have engaged in the SEND Green Paper, and how you're intending to engage going forwards as it moves forwards to being legislation, and also a little bit about your thoughts around whether you think the national standards should include community health services.
So I can speak from my perspective, having worked really closely with the SEND review team over the last year, and even before, and having planning for these health events that we're having. The first one on Friday, we'll be asking similar questions like you're asking me around what does the national framework look like for health? What should be in it? How should it work with the frameworks that we already have in health around monitoring and performance? How does it work with our system oversight framework, for example? I couldn't be any closer, I don't think, to the team, and they're very, we work well together. We have to work obviously alongside the Department for Health and Social Care as well as the DFE. And if I'm going to speak from a personal perspective rather than professional, how could we not have our sort of metrics and work across education, health and care in there? If we don't see health in there, we've failed, basically. So I think we'll be pushing for as much as we can, but we have to obviously go within the limits of what is actually being recorded within health itself and what should be recorded for the future. And also learn from what's actually being recorded at local and regional level already, because a lot of this stuff is kept at local level within the improvement plans, but we don't necessarily collect it at national. So I think it's a good thing.
Mark, do you want to add anything to that?
Yeah, I mean, I agree. I think they do need to look across health, education, and social care. And Lorraine and I, both saw the draft and contributed to it before it came out. So there's nothing there that's a sort of surprise. It's obviously exactly, they're consulting at the moment, obviously, and then the next stage will be to turn that into a delivery plan and add the sort of flesh to the bones. And there'll obviously be a conversation to be had between sort of us on the NHS side and the department about what the level of ambition is, and how that's being resourced and funded and sort of written into the instructions that the department gives the NHS on what it has to deliver. So that will be the next, I think, kind of key point of negotiation.
Just actually a question about the London presentation. Sophia, could you talk a little bit about how is social care involved? What work are you doing to engage social care in your activities?
Okay, so with the strategic managers at parent and carer forums, social care is also invited to those meetings. So it's health, social care, and parents and carer networks that are involved. So we are updating each other and continuously working together. And when we're working, obviously, on the written statements of actions, this is joint working that we're delivering with the Department for Education. And what we do is obviously social care are included, and we have the SEND governance teams and leaders around that. And this is including health and social care. So where there are changes or improvements that are required, it's not just coming from health, it's jointly being delivered with social care. And I'm also part of the ALDEX, which is the All London Directors for Children's Services. So I attend their meetings on a bi-monthly, and during that time, we're also giving each other updates on what is happening within social care and what's happening with health. So all this work is being done, is being delivered in integration, and we are all supporting each other. The work is really much in partnership.
Thanks, Sophia. Really clear answer there. And Lorraine, could you perhaps just invite you into to comment more generally around that relationship with social care? I see that one of the 5 work streams you spoke about earlier was around the reviewing the work of ICBs and transferring the statutory duties to ICBs. Is there anything around sort of, what can you say around the social care interface in what you're doing there in the work with ICBs?
I think that's a tricky question, Marino, but one that I will try and answer. So as we know, so there's a white paper that's an integration paper, and the focus in that paper is more around adult social care. How we work, not in the ICB, because the ICB is the health part. The ICP, the Integrated Care Partnership, is where you're bringing your other partners. So as you all know, children's social care sits within the local authorities. So it's how those partners work across the partnership, bringing in the children's side, will be really important. And of course, we can't do anything without looking at the children's social care review, the SEND review, the integrated care reforms, and also the schools white paper. They all go together. How we work that out in practice will be, in the main, a lot of it down to our local leaders. So the Integrated Care Partnership guidance is being drafted up. The Integrated Care Board statutory guidance around SEND is in its second draft. So we will be looking to our executive leaders on the ICB boards to be the lead for SEND. Now, as we've worked through that with our heat map exercise, it's looking pretty good at the moment. Everyone has an exec leader or a senior responsible officer in place. Some people are still going through recruitment. So it's our job nationally to support and influence those leaders, but equally challenge them to make sure that they're doing their job. So our regions will really be doing a lot more work around these new leaders to make sure that they are the voice of SEND and that they are accountable on the board as a delegated duty. So that's all I can say.
Thanks, Lorraine. And I think that I don't know whether your regional leads would be in a position to share those heat maps with the PCFs in each region, because I think that would be really instructive for us to look at those heat maps if that's possible.
I think that might be possible. They will be able, I would expect them to be talking about what's coming out of those exercises with not only the parent carers and regional leads, but with their other partners in region. We're just pulling it together at the moment, but it will be an ongoing exercise quarterly through the next year as well. So it's not a one-off.
So we can hopefully look forward to seeing those and the PCFs on this call. Maybe if you haven't had sight of those in the next 6 months or so, just ask your regional NHS lead to update you on where they are. A couple of comments from I think it was Parv expressing a lot of frustration. I think that we would all recognize and feel around autism assessment and support services in the local area, and also OT practices in the local area. And I think that part of the things that you've documented there are very much the things that we are hearing nationally and that we've played back to Lorraine and Mike and others. And just as I'm speaking, another message has come up from Mary around the relationship between the SEND review and the Children's Social Care Review, which I think we would recognise that there's a real danger that children with SEND fall between the gaps between the two reviews. with that, I think I'll hand back to you, Lorraine. You are going to take us through some thoughts around co-production.
Yeah, just one more slide where I'd like to bring in, it's two questions really, but I'd like to bring in some of the regional leads, so hoping that they can turn the cameras on, because I'd like them to share where they are and what they've been doing in the region. Because if we don't share what's going on, we don't learn from one another, and equally we don't challenge one another. But also we want to come out of this call thinking, well, how do we continue to work together to strengthen the voice of children, young people, parents and carers? So I'm putting regional colleagues on the spot, but I know that they have done a lot of work. So please put your cameras on and show your face.
I can say hello. Hello.
Yay, Mark. So Mark, what would you like to talk about from the Southwest perspective?
I think from a Southwest perspective, I think we need to sort of celebrate the work that we've been doing with the Parent Carer Forum across the last couple of years, particularly over the COVID. Okay.
Oh, we've lost Mark.
Oh, technology's gone. Hang on. Can you see me now?
We can see you, but you're frozen, but we can hear you.
Okay, so yeah, I think a lot to celebrate that we'll be doing in the Southwest. Apologies for that. My brand new laptop is playing up as they do. There's a lot of work that we'll be doing with the Parent Carer Forums, ensuring that co-production is at the heart of what we do, not only within the local health systems, but regionally as well. We're doing a big piece of work with children and young people at the moment. To ensure that we are hearing the voice of children and young people within systems and regionally as well. So there's lots of really good stuff in there. But what we have done, we've worked very closely with Tina and the 15 parent care forums we've got across the South Lakes to make sure that we are regularly meeting. We meet with Tina on a weekly basis, and she's and we have funded Tina to be part of what we are doing to support not only the COVID period, but the post-COVID period, hopefully. So lots of things, Lorraine, you put us on the spot. Not quite sure what else you would like us to say, but I could go on for ages.
I think that's absolutely fine. And it's nice to know. And, we can share more stuff at a later date, but I know you work really well in the Southwest together. I'm going to come to, and I have a slide that I will put into the pack, Mark, with your other team members, so Rihanna and Gemma, so that colleagues know who you are. I'll bring Debbie in next, if that's okay, from in the Midlands.
That's fine. I'm Deborah Ward. Obviously, I cover the Midlands region as one of the SEN leads. We've been doing a lot of work around with our Parent Carer Forum in the region, and what we have is a regional group where we meet with the DFE advisors and our Parent Carer Forums to discuss any challenges, work out a plan on how we're going to communicate key messages to our systems. So we have a real close partnership working across the whole of the region in regards to the work on SEND. We're also support work via our written statement of actions and our APPs around really strengthening co-production as key in some of that work that we do there. So generally we've done lots and lots of work. We always include our parent carer regional leads in any pieces of work that we're working on in the region to make sure that they are, really, part of that work and that it's influenced by themselves as well. So, Nick, I noticed you're on the call as well, so I don't know if you want to add anything.
Yeah, hi everybody. I'm Nick Harrison. I'm the Senior Programme Manager in the Midlands and work closely with Debbie. Yeah, from our point of view, SEND came into the LDA programme at the back end of last year. So I'd still say it's relatively new to us in terms of the processes and the roles that we've got. We are developing a number of new roles, which I'm in one myself. Debbie's in one of the roles as well. We are building up that resource from a SEND point of view. So if colleagues bear with us in terms of making sure we can get to a point where those roles are embedded, we all know what we're doing. We all know where we're kind of fitting in. So that's something we're working on as a team. We have got a role that's out currently to advert for another additional resource from a SEND point of view. So we're really working hard around making sure we've got that right resource, and then looking out from that. Debbie's been the real key in terms of SEND in the region for a while. So she's kind of got a lot of those connections that we are going to kind of continue to build up. We're starting some work with our parent care forums to work a bit more closely. Debbie's done a lot of work with them, but we're going to set up some calls around making sure we can support the parent carers in our region a bit more than we've probably been able to before. We've got some finance that we're going to send out to parent carers as well. So that's a real bonus from a regional point of view, taking a bit of a lead from some of the work that's gone in the Southwest from Mark and the team there. So looking at how we can support the parent carers in our area. So yeah, I think it's really exciting from a Midlands point of view in terms of the resource we're going to have going forward, and how then we link in and bring all those partners together. Again, Debbie's done a lot of work around that matrix from an ICB point of view in the Midlands, do a good position around that. Still work to do, like there is in every area, but I think we're doing okay from our point of view. So yeah, so lots of work to do, but exciting, I think, from a Midlands point of view.
Thanks, Nick. Thanks, Debbie. I noticed that Adeline Gibbs from the South East has had to go to another meeting, but we'll definitely be connecting, so that's great. I also noticed that Northwest colleagues are on the call, so I don't know if Janet or Lindsay would like to say anything.
Yeah, I'm sure we can. Thanks, Lorraine. I'm Janet. Lindsay, who's also with us, is my job share. We're very new in post, still in single weeks, I am. But we've had opportunity to make contact with Kath from our Northwest region. She's actually joining our team meeting tomorrow. That'll be face to face. So we've recognised the importance of working with our parent carer forum. We've made some links also with our Northwest Youth Focus lead, so that as well as working with families, we can link directly with young people. That will be a focus of our work going forward. Obviously still very new in post, but hoping we can work this up and get more engagement. I think there's been work from our lead, Kelly Taylor, so we've got families from the SEND sort of world working on some of the wider children's transformation agenda, so making sure that SEND is featured in some of the asthma programme, for example, and we'll hopefully theme that across into epilepsy and build on making sure that SEND is as inclusive as possible in all the work streams.
Thank you, Janet. And I noticed that my colleagues from the Northeast aren't there, but I know that Joe's on the call and works really closely with Chris Brown and colleagues in the Northeast. I join their meeting every month. So it feels like people are connecting. Joe, I didn't know if you wanted a last word before we finish.
I knew I was going to be Johnny on the spotted. I just knew it. I was looking through the guest list going, is Chris yet? No, she's not. No, we work really closely with Chris and other health colleagues. In fact, I have a role within the NHS in our ICS, which is specifically created for family carers, to ensure that we were involved in as many family carers from as many other areas as possible outside of the PCFs as well. But we work really closely. We do get funded. We're currently having some leadership training for our regional PCF team, which has been funded by NHS to build on the sustainability and capacity in regions. So yeah, we're really heavily involved. And yeah, I think it's working really well here.
Great, that's good to hear. And I didn't manage to bring in Louise from the East of England, but I think we're on 1 o'clock now. But Louise, you might just want to say a quick hello.
Hello everyone. I was trying to add into the chat. I don't know if you can see me. It's on a slightly different system, and I can still only see Lorraine on my screen. So just hello to everybody. I'm the new regional SEND manager for the East of England, and we're starting to work very closely with Marunal and the team. And we have some dates in the diary and some plans moving forward. And we've also just been supporting some PCFs in our areas in preparation for revisits as well through deep dives. So we're getting those networks out there, and the tentacles are spreading really. But I'm really happy to be contacted and looking forward to working with you all. Thanks, Lorraine.
Great. I think I've done the 7 regions now. So I don't know, Kath, are you closing or Marunal?
I'll close. I think Kath's having some tech issues, so I'm closing. So thank you, everybody. What I take away from this is that there is still a lot of work to do. I think there's also, you know, one thing I'm saying to everybody is that if anybody says to me now that COVID is finished, is over, we're done with, I'm biting their heads off and sort of saying, absolutely not. Come and talk to any SEND families, and we are still very much experiencing the backwash from COVID. And to be clear, it wasn't particularly good before COVID for a lot of our families anyway. So there's still clearly a lot of work to do. I don't think anybody is saying anything other than that we've still got huge strides to make in improving the lot of families with SEND, and some of the comments in the chat just reflect that. But I think hopefully what today has done is emphasize to people that actually the messages are getting through to people like Lorraine and to Mike at NHS England, that they are similarly of the same opinion, that there is we are nowhere near where we need to be. We're telling them that, but also their own data is telling them that. They're triangulating that with other sources of information, so they're recognizing those challenges, those issues in the system. I think the other thing we hopefully take away from today is that there is new structures, there are new people, there's new money going into SEND, and there's a new focus in SEND from NHS England. As I think you said earlier, Lorraine, you know, the SEND team for far too long a period was just you. Now we actually have some real substance behind it, both nationally and regionally, which is brilliant. And so this gives us something to push against and something to work with. So really, please do reach out to your contacts, reach out to people who introduce themselves on this call, and let's start doing some of that work that we all know needs to be done.
Absolutely agree, Marunal. We need to connect together more, learn from each other, and continue to communicate. So thank you, everyone. And thanks to everyone who's joined and everyone who's participated. It's been a great session, and let's do more of it.